And hello, everyone. This is Philip Young. As Russ introduced, I am practicing in California for acupuncture over 23 years, and also been teaching 13 years for traditional Chinese medicine, acupuncture, and also herbal medicine. Since I've been always in the clinical practice, so I just share something with everyone about the health. Today the title is digging the root cause of the diseases. We just take GI problems as the example to trying to illustrate what's the root cause of the diseases, and also how to solve the problems completely instead of just treat the symptoms. So I will have three major diseases to talk. One is GI problems, the other is menopause syndrome, and the other is third is arthritis. First, about the GI problems. We know GI problems is related with stomach and intestine. They are the most common problems affecting the GI tract, including the colon and rectum. The most common symptoms like constipation, irritable bowel syndrome, is called IBS, nausea, food poisoning, gas, bloating, it's called GERD, and also diarrhea. This is the most common symptoms. And this is once someone gets this problem, is bothering mostly almost forever. And there's no any limit of the ages. It could be any age, like from children or adults. The youngest children who have the GI problems, teenagers. Currently, there's one who is only 12. He just come last week. He had a very, very severe GI problems. That's worse than these symptoms. He has bleeding in the stool, and always diarrhea, always stomach pain, and also severe pain. There's no any discipline or time to track. Could be any reason. It's not related with food. And the doctors is giving him the let me see, over 10 kinds of medication, including steroids, but still cannot control his symptoms. And this affects his growth. That's really bothering him, but also more bothering about with his parents. It's really suffering. And in the anatomy or physiology, the GI problems, especially like a GERD reflux, acid reflux, is caused by the muscles in the lower esophageal sphincter. So this is either aging, or for some reason it's looser. It's not elastic, not strong enough to hold, and not follow the right rhythms to open or close. So the acid reflects up, going upward, even up, go to the throat. That's the general knowledge we know. And what we want to find out is what's the cause that. By the medicine, we know the factors that lead to the GI diseases: eating diet like a low fiber, and not getting enough exercise, eating large amounts of dairy products, and stress, and overusing anti-diarrhea medications, that over the time weaken the bowel muscles and the movements called motility. And so on. So see this, maybe someone is caused by some other medications, and also taking antioxidant medicines containing calcium or aluminum. So these are also can lead to them GI disorders. And also taking other medicines, especially the antidepressant, iron pills, and strong pain medications such as narcotics, and so these are caused by medications. And also another is the traveling. Maybe traveling change the routine or change the locations affects someone. And also someone may be caused by the pregnancy. During the pregnancy, they have the GI problems, but after delivery of the baby, there's no problems. And there are another factor is resisting the urge to have a bowel movement, possibly because of the hemorrhoids. And all these are the common medical factors that lead to the GI diseases. But someone, actually most of the cases, the patients cannot track what the exact causes. Even they may match some of the causes, some of the factors, but even let's say reduce the stress, like the children, they say, okay, just take a break, don't go to school. We can go to exercises, do some activities or whatever you like. Then still cannot get rid of the symptoms. So there must be factor or cause behind these factors. Treating GI disorders, these are the general approaches. First, resting and drinking plenty of fluids. And the second is following the bread diet, banana, rice, apple juice, apple sauce, and toast, and all of which are easy on the stomach and beneficial in their own way. At the same time, avoid things like dairy, grease, and spices, as they can aggravate the digestive system. So these are the actually most patients who have the GI problems, they were told by the doctors, and they are very careful with their diet. And mostly they become the specialist of the GI disorders, so they really know what should eat, what should avoid. The next is taking the over-the-counter medications like laxatives for constipation and something. Yeah, these are very, very common. Someone take the anti-acid medications and so on. There's a lot of them over-the-counter medications. And the next is upon being examined by medical providers, doctors definitely prescribe some medication for you, and for like a nausea to provide the comfort, and did ability to rehydrate. And if someone has the nauseous, and so they will get an anti-nausea medication, and if it's more severe, they will get an IV rehydration and so on. So these are the general treatment for GI disorders. And for GERD, the GERD, first we need to change the lifestyle and the dietary changes, so suggested by the doctors, and also medication, different kind of medications. If still cannot solve the problem, that will be endoscopic therapy, or the worst is, no choice, to get surgery. Then I just mentioned that there must something beyond what we can find the common in the common statistics and information. What's the cause, or what's the factors, or what should avoid, how we can solve the problem. If still in the regular approaches, we still cannot solve the problem, then there must be something else beyond these factors. If we said that's the bugs for GI, so what's the bugs? Let's disclose the GI bugs. This is the spine. The spine, I just take this part, which is related with GI, the digestive system. The whole spine is from C1 to 7, cervical 1 to 8, plus the first one. Then T1 to 12, the thoracic. So cervical, thoracic, and there's a lumbar 1 to 5, L1 to 5, then sacrum, S1 to 5. So these are the whole spine and all the vertebrae. And we know the central nervous system reside along the spine. And different segments of the vertebrae and their corresponding nerves are related with the corresponding areas. Like here, this affected the ENT, the eyes, ears, and nose, and so on. But here, today, we only talk about this part, the lumbar, colonic, and this hypogastric nerve. These nerves are all related with the digestive system. That means starting from T5 to T12, these are digestive system, including stomach, small intestine, large intestine, and all the related symptoms, including all the digestive issues, acid reflux, stomach bloating, stomach pain. There's an unknown cause of the pain, and including H. pylori and many problems. Whatever the problems, mostly for chronic diseases, not related by the food poisoning. It's not. That's the acute. So all the chronic problem, we can find the root cause in this area. Intestinal problems as T12, then L1 to L5, including like a constipation, diarrhea, and also excessive growth in these areas. Like someone has the excessive growth, like polyps, tumor, and cysts, especially the colon polyps. That's very common. Oh, why you get a colon polyps? You just get it. By the endoscopy, we can the doctors find the polyps and just remove it right away. For stomach, it's a little more complicated. Currently, I have a patient. She was diagnosed with multiple polyps cysts in stomach, intestine, and also uterus, and also ovary. Uterus is fibroids, and ovary is cysts. So she was scared. Why she has so many excessive growth? That's all. When you check the spine, starting from here to here, none of them are aligned. There are many misalignment, crooked, calcification, and hernia disc, and so multiple problems. But she's not old. She's only 35. So the spinal problem caused the internal organ problem. So in another way, if you're familiar with the spine, I know chiropractors are familiar with the spine. I'm not a chiropractor, but the reason I'm so care about the spine just because I was forced to pay attention to the spine. there are many chronic diseases that couldn't be cured, including, of course, I just practice Eastern medicine, acupuncture, herbal medicine, the traditional formulas and even special formulas still cannot cure the problems. Then eventually I find the root causes in the spine. When I remove the spinal problems, the chronic corresponding disease can be completely cured, such as acid reflux and stomach pain. There are many, including kids. Like my daughter, when she was 3 years old, I took her to go running with me. And in the park, she said, stomach pain. So, oh, such a young girl, stomach pain. Then I feel her spine. That's 7, 8, leaning to the left, leaning to the left this way. So that's caused the pain. Usually when the thoracic spine in these segments leaning to the left, that causes stomach pain, stomach bloating. So I through the diagnosis of the spine, I've been summarized a whole series of the diagnosis technique, which is not practiced by Western medicine or Eastern medicine, even chiropractor. I have many chiropractor friends. I said you can use your hands to make diagnosis. Even the patient don't tell you what the problem is. They say no, they don't diagnose it that way. They usually diagnose it by X-ray or something. There's a difference between the X-ray and your feelings. Even MRI has more a high definition to find out the condition of the spine, but still there are a lot of information is missed because like the surrounding soft tissue, like the ligaments and muscles, if they are knotted, they cannot be found by the MRI. MRI only can find the bone condition. And also there's differences. Even the bone, if there's a little bit of protrusion, the MRI may consider this as normal because they cannot tell too much difference. So this is normal, but by the hand feeling, it's not normal. So this is how we make diagnosis by the spine. So I just name it spinal diagnosis, just by the fingers. So very quickly, if the thoracic spine, this part, these segments tilt to the left side, you must have digestive issues. Then if it's calcified and crooked and calcified and knotted around the vertebrae, you may have excessive growth, like this part in lumbar, excessive growth like polyps. That's very common, and so on. So all these GI problems that are in this area, we can find the root cause this area. So that means if you want to treat the GI problems fundamentally, it's called cured, not controlled just by symptoms, not just make them comfort. Then we have to treat here because this is the root cause. I cannot say I'm 100% right, but at least in my clinical practice and from the process of the treatment and the recovery, the patient tell me this is right. Okay, generally, the spinal problems are like this, the deformities of the thoracic spine in this area. That's a general condition. And deformities including these cases. This is a normal disc, and this is degenerative disc. See, this disc is we can clearly find this is degenerated, and this is a bulging disc. The bulging disc is one side is bigger, one side is smaller, so they cause the bulging not in the original position. And a hernia disc one side bigger, one side smaller, and also to make the vertebrae tilt to one side. Of course, this is it's just a regular picture. It's not real condition. The real condition is much worse than this. And this is a thinner disc, thinner, not as regular. And of course, the spine have to tilt to one side, cause bending. They must cause the corresponding problem in this area. And disc degeneration. That's another degeneration, maybe combination of the vertebrae problems and the disc problems, so thin that must pinching nerve cause the pain in the the legs or hips or the feet, or if it's a thoracic area cause the GI problem and so on. So that's the general conditions for deformities of the spine. And different spinal problem deformities inside the body will lead to the corresponding nerves problems and also circulation problems and also functional problems of the corresponding organs or tissues. All these congestions is similar, just like traffic in a city. In a city, the highway or expressways or the local boulevard and or something, all the road is supposed to be goes smoothly, but because of a lot of traffic or sometimes get a car accident, so that causes the traffic jam. And we can see, if we see from the top, from the sky, oh, somewhere is clouded with a lot of lights. So we can say the traffic jam of a city is a kind of disorders or diseases. Then what's the solution? The solution is clear the traffic jam, make it flow, go smoothly. Then the sickness is gone. Similarly, inside the body, we need we always easy to cause the traffic jam. In Chinese medicine, we call it congestion, including energy congestion or stagnation or blood stasis. This means there's different levels of the congestion, just like different levels of traffic jam. Some just like the maps, the Google map, if it's less congestion, just slow down, it's yellow. Almost stopped, this is red. It's totally jammed. So different levels of the traffic. Then the solution is we need to clear the traffic. If it's a car accident, you need to tow the truck, tow the car away, which has been crashed. So then we need to call the police and need to call the tow truck, need to tow them away so the traffic can move forward. Same thing, inside the body, we need the police. Who is the police? I'm police. I use needles to put into the relevant points, which correspond. This is a GI problems. Okay, I have the points in tummy and also in legs, so that will put the needles inside. It's just like a tow truck to clear the traffic. When they start moving, then the body circulation is close to normal until it's completely normal. Then the body function, like the GI system, will be functional normally. So this is how we do the treatment. So we do the fundamentally to treat GI disorders, we need these approaches: acupuncture as a police, moxa, because some part the reason the deterioration of the vertebrae or this just because of the deficiency of the kidney. And we have two kidneys, one's yin, one's yang, left and right. One is deficient, the other is strong, they're out of balance. Then the result is cause them some ligaments, the muscles and the bones, they get out of balance. Then they curve to one side. Then you, in order to completely align it and make it fixed, so that you call it as a cure, that won't bounce back, you have to make up the deficiency. Like the left kidney is weak, make the left kidney get stronger. We use Moxa. What is Moxa? I believe some of you may know, or at least heard, what is Moxa. Moxa is a miraculous, even I call it a miraculous herb, because there's no any substitute of the herb. The herb can grow everywhere. It's called a mugwort. This mugwort, I grow one bunch in my backyard. Then the next year, a whole piece is full of the mugwort. So long as we have the water, like after the rain, they grow a lot. And there's a nature of this mugwort. When we burn it, it generates a heat. Okay, of course you can have any kind of heat. You can have hot water, you can have the fire, you can have the infrared, whatever you can, this generate heat, but no any heat can compete with the Moxa heat, because not only they have the heat, but also they have not nature. This mugwort, after they burned, they can follow the meridians. This is stomach meridian, this is the liver meridian, this is the kidney meridian, can go to any meridians. Which meridians they should go? Acupuncture. Acupuncture right now, apply the needles for stomach meridian and the intestine meridian. Oh, the Moxa will follow your meridians to go. Then when they find it, there's a traffic jam, it's clotted here. Okay, they will unblock it, clear, 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 and it is open. If one office visit cannot open, 2, 3, until it's completely open. And the patient will feel, oh, my back is better. My stomach, the digestion get improved. So that's the effect. And your meridians curve this way, that way. So the Moxa can follow you, go curving and find your the route. And also, when the mugwort, when they find some organ is deficient, is weak, low energy, then they can make up, and then they stay there. So the energy become yours. There's no, so far, there's no any electric device can substitute this one, and there's no any other herb can have the similar nature to substitute the mugwort. That's why in the past 5,000 years, we've been using the mugwort, burned, smoking, and many people, they say, oh, I like a Moxa, but I don't like the smoke. That make my clothes just like a smoker's. Yeah, it's really, really smelly, but it really works, and even increase your immunity. Like during the pandemic, I use this a lot. That's a very, very good prevention for the pandemic. Because this is Moxa. That under the herbal medicine, we diagnose the corresponding conditions, energy conditions, and make the corresponding herbal formula to treat the problems. Like for acid reflux, we have a formula to make the stomach energy going down instead of going up, so there's no reflux. And also, the stomach problem may lead to the liver and stomach disharmony. So we have to smooth the energy flow or calm down the liver heat to make it balanced, so that liver and stomach get harmonized. Then they won't cause problems, and so on. So we'll make diagnosis and make the corresponding prescriptions. And then the next is the Qigong. What is Qigong used helpful. I believe some of you may heard of Qigong. There are different types of the Qigong. The traditional Qigong is for practice, but there's a medical Qigong is for treatment. I'm practicing the medical Qigong, and also I teach medical Qigong. Apply the Qigong philosophy and techniques in acupuncture and herbal medicine practice. Like, I just give you an example. You may think that's exaggerating, but I can tell you that's truth. There's no exaggeration. Like, if there's a bone spur, oh, there's a hernia disc, then like this is very, very bad, cause a lot of pain. Then with Qigong, just one of the Qigong techniques is I just touch here and send the energy, send the Qi. Then that can essentially change the bone condition, make it shrink, and aligned. Of course, may not be one time, maybe need several times, but at least one time shrink or align some until it's completely aligned. Then the symptom get better and better. And this is how I treat the GI problems, and also like migraines, arthritis, protrusion of the discs, bulging discs, and so on. Sciatica, there are many, many problems because of deformities. You have to change that so that you can treat it. So Qigong is very, very helpful to treat the essential problems, to change it completely. So this is Qigong. Then others like a correct T10 to 12, which is corresponding to the stomach. L1 to that's the intestines. That's the most frequent problematic area in the GI system. Then after the treatment, we have to teach you the therapeutic exercise. Based on the diagnosis, if your spine is protruding to the left, so I'll teach you the technique, like slow motion, tilt the body to the right and hold 6 seconds, then back to the center. So center, right, to correct the spine. There's another way is twist the body to the left. Twist the body to the left is just like a pushing the spine back to be aligned to the center. So twist and the center, twist to the left and the center, all slow motion. So these are therapeutic exercises as your homework. So you have to do it so that we can consolidate the treatment effect, and also that helps to make more improvement. So all these techniques together will treat the GI disorders completely. So mostly this can be treated. In the clinical practice, I get statistics, which age group have the GI problems more frequent and less frequent. Either one are the same, okay? So adults, that's the most common. Why is that? Later, let's analyze. Teenagers least, and children, even the babies, they have more, and the seniors, medium. Why? This is seniors have the less GI problems than the regular adults. Why is that? I believe you can guess why. Stress, very, very busy in work, and junk food, irregular diet, and so on. Just take whatever they like. So this is really causing more problems. And seniors usually they are very, very careful with their diet, but because of the aging and some degeneration or something, they do have more problems than the other age groups. And why the teenagers they have a least? Because teenagers are the most active age group. They do a lot of exercises, and plus they are young. They have a good energy condition, so they have the least problem. And the babies, they have to be taken care of by parents. Someone born in the weak body constitution, someone maybe feeding or some other issues, they may have little more problems than teens. So these are the clinical statistics for the age groups. So this means, from this statistics, it means we need to do exercises. We need to maintain very well, like a regular eating, healthy eating, and also more essential is what we talked about just now. Maintain a good spinal structure. Okay, so these are all about the GI, the treatment for GI disorders. Then the others, similarly, we find the root cause for the menopause syndrome. This root cause is a little different with the GI disorders. Here, I just have a very, very brief comparison with several items like origin of the hormone and the solutions and effect and side effect and something. And this is a Western medicine. This is a traditional Chinese medicine. We know the menopause syndrome is caused by the hormone imbalances. Just estrogen is low. And by Western medicine, we know the hormones generated from ovaries. And by Chinese medicine, yes, the organ is through the ovaries, but the root for the hormone is from kidney, especially I just mentioned the kidney yin and the kidney yang. That's from kidney yin. That means the left kidney, exactly. And solutions, the Western medicines give you the hormone replacement. And we know the side effect for the hormone replacement is increased 20% of cancers, including breast cancer and uterus cancer and so on. But it's very, very effective. It's very effective. The symptoms like hot flashes, restless, and insomnia, and so on. So these symptoms can be controlled maybe the same day. Oh, so much better. That's horrible to have these problems. And with the TCM, based on the concept of the low hormone, low estrogen, then we said it generates from kidney yin. So we prescribe the herbs for kidney yin. Then if the prescription is right, then you can get the symptoms released or reduced either the same day or a couple of days. So that's slower, but still quick. And there's no any side effect. You said, oh, that means you generate some hormones to balance the hormone? Yes, because the hormones fundamentally originated from kidney. The reason the ovaries doesn't secrete the hormones anymore, just because here there's no any supply. This is the plant, the manufacturer stopped producing the product. Why? Because the age. Then we have to do the substitute solutions. That's to make up. Herbs is a direct makeup, and also we have food. Later, we'll have the list of the food to make up the hormones in the natural way. And the next example is arthritis. Arthritis, the blind spots of the arthritis, this may give many people reference because so many people have arthritis. There are different types of arthritis. Arthritis, rheumatoid arthritis, and osteoarthritis. So arthritis, especially osteoarthritis, is very, very common. It's also related with age. Over 50s, easy to get arthritis, like deformation of the finger joints, pain in the joints. In the beginning, maybe one side, later both sides. In the beginning, one finger, two fingers, then all the fingers get deformed. It seems like there's no way to stop the process to get worse. But if we find the root cause of the problem or the related cause of the problem, we really can first stop the condition getting worse. Second, we can reverse. We can treat it completely. Here, the deformation or pains, that's the symptoms of the fingers and finger joints, is caused by the circulation problems. Oh yeah, you have poor circulation. Where is the circulation? This is the finger, this is the energy supply to the fingers, to the joints. Then must be go through here. Then here, there's a key areas, the thoracic vertebrae. Specifically, is T1, 2, 3. That's most common. And when here is enlarged or deformed or calcified or crooked or whatever the problem of the disc or vertebrae is, so that may block the circulation. If it's tilted to the left side, the first problem will show up at the left hand. And so of course, they may combine with some other symptoms like a tingling of the fingers or weakness of the arms or pain and something. If it's enlarged and affects both sides, that will cause both sides of the fingers arthritis. So when we get diagnosed with the exact spinal problems in T1 to 3, then we fix it, then the circulation is generated. And the pain will get reduced. First, they stop deformation, stop getting worse. Second, we do something to reverse here, that's treated local. And why the vertebrae get enlarged or deformed, like bone spurs or something? Because the kidney deficiency. The kidney deficiency, specifically kidney yin deficiency, the left kidney. Why the kidney yin is deficient? Either stress, overuse, overwork, or aging. So that's why aging is the enemy of our longevity. But nobody can avoid aging. Then that's why we have to do something proactively to improve the kidney condition, kidney energy, so that we can avoid the problem or treat the problems, at least less suffering, or avoid the suffering. That's really avoidable. So solutions. We cannot stop aging, but at least we do something to strengthen the kidney. That's the fundamental solution. Usually Moxa prescribed herbs, diet, special diet. I call it kidney food. Later I have the list. Then that to improve it. Then acupuncture to improve the T1 to 3 and naturally generate circulation and treat deformations. That's also very, very effective. The reason I talk about this so firmly, just because it's clinically approved, not just one case or 10 cases, many cases. Okay, so solutions for the decay of the hormone. That means to reverse the process of aging, we could be delayed aging. First, good sleeping. Good sleeping is proper sleeping, means proper sleeping hours, proper sleeping time. There's a number. The best sleeping period is 11 p.m. to 3 a.m. That's what I call it golden sleeping period. And how many hours do you sleep? Usually 6 to 8 hours in between, depends on the age. But for children, they may 10 to 12 hours, and the baby is 12 hours, 14 hours. And adults, usually 6 to 8. And for seniors, just 6 hours. So that's the duration of the sleeping and the time of the sleeping. That is called proper sleeping. Very important. The sleeping process is the rejuvenating and also is like a recharge of the body. We're charging the batteries. And the second is diet. Diet is a regular diet and a nutritious diet. Here, emphasize the nutritious diet, nutritious foods, and dietary supplements, herbal soups or dishes, and seeds and nuts, and so on. This is a healthy diet, especially to the kidneys. And the third is exercise, walking, jogging. Compare jogging and walking. I always suggest my patients, what do you do exercise? Oh, I do a lot of exercises. Now, what do you do? I walk 5 miles a day. Oh, that's good. But if you walk 5 miles, why not do jogging? No, I cannot jog. I can only do walking. So you can do little jogging, and when you're tired, do walking. Jogging and walking, jogging and walking. That's a different exercise. Why? Walking, see, our lower back doesn't move. Then we do jogging, the lower back start moving. And the lower back here, kidneys, the kidneys reside in the lower back. Arrow 1, 2, 3 for area. So jogging is good for kidneys. And of course, it depends on your health condition, your aging, to control your intensity for the jogging. And also gym, yoga, tai chi, boxing, kung fu, qigong, and so on. All the exercise is good exercise, so long as you do it consistently. That's very important. And the next is qigong. I especially mentioned about the qigong, not only because I'm the qigong master. The main is I understand more and deeper about the qigong. But you have to follow the right qigong masters. I believe many friends love qigong, and they learn from online or from different masters. Some masters are very, very good. So follow the right masters. And movements and standing meditation, breathing techniques, the visualization, the sitting meditation, and so on. A lot of qigong techniques you can practice. And the herbs, as I mentioned, there are many, many herbs. Here, he said, oh, all these herbs, I don't understand of the herbs, but I believe these are the herbs, but also food you may be familiar with. Gingos, maca, these are from South America. It's very interesting. Actually, ginkgo, there are a lot of ginkgos in the US, but nobody know this is eatable. These are herbs and also good food. And some trees, oh, they have the ginkgo fruits everywhere on the ground. And goji berry, you can buy it from Costco, from Whole Foods. Very, very good quality goji berries, about 10 to 12 bucks per bag. And mulberry. Mulberry, I know someone have the mulberry trees. They don't know that that's good fruits, and it's a kidney food. Very, very, very good kidney food. Yam, and then others. These are all the Chinese medicine, so you may not familiar with. So these are foods. At least when you take all of them, take them. There are herbs and also foods. Very, very helpful. And also here we just mentioned the moxa and meditation. The sitting meditation combined with the breathing. You get a oneness and emptiness, but before that, it's better do some breathing techniques. Then they will use the qi to neutralize the organs and do the meditation. You get a high efficient effect for rejuvenation. This is the qigong and the tai chi. Okay, kidney foods. If you like, you can take a picture for this one, because this is it'll be very, very helpful for you. Seed, all the seeds, any seeds, sunflower seeds, apricot seeds, watermelon seeds, whatever the seeds are, these are good for kidneys. Why? Let's see, seeds, nuts, beans, all these are the seeds for new life. They can generate new life. that means they can generate hormones. The similar nature, kidneys have the similar nature, generate new life. So similar nature, they will benefit the similar organs. So all these nature of the foods good for kidneys. Nuts, any nuts you can find, walnuts, cashews, almonds, hazelnuts, pistachios, and so on. And beans, all the beans, especially black beans, all the black color of the food go to kidneys, and all the beans. And also dark food, any food you can find is dark. Black sesame, black beans, black fungus, seaweeds, black rice, and black mushrooms, and so on. All these good for kidneys. And the fruits, several specific fruits for kidneys, not the others, especially mangoes, jackfruits, durian, figs, and guava, and so on. Fish, meat, is shellfish and red meat are very strong to the kidneys, especially kidney young with the right kidney. But if you take too much, maybe generate excessive heat, causing nose bleeding, and so on. So this is my sharing of the basic concept for digging the root cause of the diseases. And thank you for your participation.